think we're going to go ahead and start. So I'm going to start by just introducing ourselves. My name is Aisha. I work here at CARD. I do international evaluations on long distance and treatments with the majority of bilingual kids. And
my name is Zaina Vemba. I'm a speech language pathologist. I work at the Child and Family Support Program here at Krieger. I work in a community-based setting, and I also give assessments and treatment in Spanish and English. Okay, so these are our learning outcomes for today. We want you all to learn research regarding impact of bilingualism, dialectalism, and socioeconomic status. We're also going to talk about some non-biased assessment tools that are culturally and linguistically appropriate. And we also want you all to be able to identify skills needed to assess bilingual children. So some questions that we want you all to keep in mind during the evaluation or during the presentation are: why is it important to administer culturally appropriate and responsive evaluations? What are some reasons that you would need to evaluate a bilingual child differently than a monolingual child? And whether a child has a disability or if they're eligible for a program. And we should also make sure that our assessments are not culturally or linguistically or racially biased towards the child that we're evaluating. And we should also make sure that we're providing these assessments in the language that will yield the best information from the child. Okay, so how do we interpret IDA? What does that say to us as evaluators? We know that we shouldn't base our decision on one single standardized score. That can't give us the most information about our child. We should also think about if we're administering the assessment in a way that's biased towards that child. So we should think about, is that child being judged on a culturally based standard that is not relevant to them? So some children in their culture may not have a value for a known answer question such as show me your nose. So if we're judging them based on that concept, that would be biased towards that child. We also need to think about, is the child in the norming population? Is this who the test is designed to assess? And we put a quote here that says that we should adopt an approach that works to distinguish a disorder from something else. So that something else may be second language acquisition, SES, socioeconomic status, prior experience, or dialect. And currently no standardized test can tell us if it's disability or a lack of adequate instruction or one of those influences happening.
And the IDA says, like, if the child is not representative, you don't need a standardized test. It's not a requirement. So components of culturally and linguistically sensitive evaluations. No two children are the same, and that also know with monolingual kids and bilinguals. But it just adds another different, more complex layer when the child is multicultural. Consider the level of language input to use a specific data. To evaluate the output, we need to know the input, the different dialects, the different percentages of what language they're hearing this way and what the other, for example, they're hearing more academic language in English, so that would be stronger suited academically, but if they use more another language socially, so that's kind of even the quality of language that we're evaluating. So the other point, it just talks about, like, this determine the background, and the same thing about, like, where they're getting their input, so we can evaluate their output. So thinking about the mismatch that we bring, we come with our own culture, with our own values, and then the kid comes from a different background. So I think it's really important to know where we're coming from and why I'm doing this. And is that just, I think it's normal? Is it my own norm, or is it the child's norm? And I feel like that takes a little bit of, like, self-evaluating to know what I'm bringing to the table. And also is thinking about, like, is what I'm testing is pure knowledge, or is it really I'm testing what I'm really trying to test? For example, like colors and numbers, is that really representative of their language, or is it just because they didn't have schooling? And that's what I'm trying to, like, dissect here. The SES, we know SES has an impact in language, and that's important to know. That's why it's important to know the SES of the family, SES of the school. If it's we know like how instruction can affect language. So we're going to talk about like examples of assessment tasks. We know that parent interviews are critical. So we're going to go over 10 questions that are recommended in the literature. Opinions, informed clinical opinions, I'm sure. We have seen different kids, and we can use our opinions to decide or evaluate the kid. Dynamic assessment. Fast mapping is more used to preschoolers, but we have a resource in the handout, but we're not going to talk about it. We're going to talk more about immediate learning experience, and that's more about it targets what they know, how fast they can learn, and not their prior knowledge. So you teach the child something they're weak at, or something they don't know, and see if with few exposures are they going to be able to pick it up or not. And language sample analysis, and that could be you can get it in different ways, and we're going to talk about a little bit about that. And compare the child to their own community. If there's a sibling, that'd be great. Or if you're in school, you know, compare them with other kids who are ELL or in the same kind of closer to the community. Parent interview, we know is one of the best diagnostic tools. They spend a lot of time with their kids. They probably know them more than we do. And when you pair parent interviewing with language sampling, it shows really good tool for identifying kids who are with specific language impairment. And we'll go over the questions. What exposure has your child had to different languages and dialects? And I tried to ask this question to like, how much you speak to your kids in that language at home, and how is the school's instruction, how is the siblings are talking to the child, and just to know, to get a kind of a holistic picture of how much of each language or dialect they're getting. And when I speak about dialect, I usually try to say it's a systematic, governed way of language, and I encourage people to keep the home language and the dialect they speak at home, but I just kind of talk about it, that it's systemic and it's governed, and it's not. That's why it's important to know. The second question, the education, highest education level of the mother or the caregiver, because we know through research that correlates with language and vocabulary. Having any significant changes in the family, just to know if it's really a language disorder, or it might be trauma or something else that is not language related. If there's a family history of speech, language, or any learning problems, then we know through genetics that it runs in the family and it's more genetic based. Fifth question, how does a child's speech and language develop compared to his sibling or same age peers? And when you ask this question, the majority of parents will say yes. We think the child is delayed, or I think it's the same thing, or they were in the same level but they went back suddenly. I use this question a lot. Was the child's performance during today's evaluation is representative, or they're just having a bad day, or is that common? The child is with unfamiliar places, unfamiliar people. What does your child do that makes you know he or she is smart? So trying to kind of figure out what are their strengths and what kind of get insightful and what parents think that the children can do.
Okay, so we're gonna talk about a case study that Aisha, of an evaluation that Aisha and I performed. And we're going to use this case study to describe some of the assessment tools that we would recommend using for a bilingual child. So the first component was the parent interview, and Aisha went over questions that you would ask that would give the most relevant information to the evaluation. So an introduction to our case study, the child was a 6-year-old girl. She's a sequential bilingual of Spanish and English. And a sequential bilingual is also sometimes called a second language learner, someone who she acquired Spanish proficiency first before she started to learn English. So she had already acquired that language. She didn't learn them at the same time.
And the cutoff is 3 years old. That's what is in the literature.
So background, she lives with her mother, her younger brother, and another family in the home. And that family has a mother and 2 older children who are elementary age. Her mother was born in El Salvador and her father in Honduras. And her mother immigrated to the United States 10 years ago, and her father still currently lives in Honduras. Both parents have completed high school, and medical history and developmental milestones were within normal limits. Okay, so some of the tasks that we used during the evaluation, we wanted to look at the holistic picture of the child, not just give a test and then we take our information. So some measures that we're going to talk about are informed clinical opinion. That is us using our knowledge about language to make a decision on is this child within normal limits. Parent interview, like Aisha mentioned. We asked these questions also, we also incorporated elements of ethnographic interviewing. So asking questions in an open-ended manner to get whatever information we felt the mom wanted to give us. We're going to talk about dynamic assessment through a mediated learning experience. We're going to go over a few materials, which are school-age language assessment measures. We're going to talk about a language sample analysis and a narrative task that we used. Okay, so information about A's, as we're calling her, language, background, and use. And again, this is information that we obtained through the parent interview with the mom. So she receives exposure to only Spanish in her home and community until she started to attend a pre-K at 4 years old. Kind of a common situation here. She's exposed to standard American English dialects by her classroom teacher, but with her peers in her classroom, Spanish influenced English and also African American English. So we wanted to get information about what dialect she's hearing throughout the day as well. Again, through the older children in her home, she also hears more Spanish influenced English. She's exposed to Spanish dialects throughout the entirety of the day when she's at home communicating with her mother and brother. She also speaks to her aunts, uncles, father, and grandparents via telephone in Spanish, so she's getting also a lot of Spanish exposure as well still. She attends Mass weekly, and her mom reported little exposure to English personally, since the mother does not speak English, but the other children who live in the home who are older speak English too. Okay, so we also gained information from the teacher. So it's really important to see how is the child doing in the classroom, if they're struggling with anything, to gain information about that. So she attends first grade in Baltimore City. The school is composed of a majority of African American and Latino students. However, English is the primary language of instruction. Something that was heartbreaking to us throughout in the evaluation, she told us that the first grade teachers tell them not to speak Spanish at school. When we were asking A some questions about, who do you speak Spanish to? Just giving her information about what she feels as a bilingual child, she told us that she doesn't like to speak Spanish because the teachers tell them not to speak Spanish. So that was hard for us to hear. She's enrolled in ESL to support her academic English acquisition, but besides that, she doesn't receive any other services in her school.
And usually kids attend ESL for 30 minutes a week. So it's pretty not, it's not as much as we think as much other it should be supported. It's very low.
Okay, so we're going to talk about what are called school-age language assessment measures. And this link is also listed on the handout. But these are the materials that we used throughout the assessment. So these are materials that were created to be free of cultural and linguistic bias, and we use these to assess receptive and language skills. And again, they're not standardized, but it's something that we can assess many different skills. So some things that we're going to talk about are following directions, understanding questions of increasing complexity, sequencing ability, a narrative, and also listening comprehension.
So I'll go ahead and talk about receptive language. We give her these pictures and asked her to sequence them. And we're not really looking for a specific sequence. We just want her to we would just want the sequence to match her a logical narrative. So even if she put it in a different order, but set a cohesive, logical order narrative that matches what she did, that's fine. But she sequenced it. She made the same sequence, and then we asked her a question. She said she told us a narrative. We asked her what happened. Can you tell us the story? She said the story. But we're going to talk about it more in the expressive part. But we asked her questions after she sequenced it. Here's the question in Spanish, but we translated it next to it in English. We tried to target more like higher questions, like why did the bunny jump out of the backpack? And she gave us a reasonable response. We noticed that she used mental verbs during her descriptions. She described the bunny's motivation. She stated the character's emotion. She even thought about the teacher to think. It's a series of questions, and the questions are in the material too, like what type of questions. But I don't think anyone should be restricted to the questions that are attached to it. You can scaffold it to the kids if they need a harder question or an easier question, or what are you trying to target. And we did all the tasks in both languages. So we had one in English, but and a different one in Spanish, just to see what's her levels in the both of languages, because she's pretty balanced bilingual, I'd say. And then we showed her this card. What happened to his feet? Why it stopped? And it's designed to stay in a metro because they're designed in New York, but there's no metros here. So we said what happened to this guy in the bus, and we asked a question: what happened? How did this happen? Just to see if she can infer and draw what her thoughts. And we asked the question in Spanish. She responded in English, and that's what is interesting. We can use cause. Probably she uses more because and explanation in English, and you can see the academic language came out here. But for other questions who are more socially inclined questions, she responded in Spanish because her Spanish social language are stronger. And we asked this question: did this ever happen to you?
So this we bolded this part because we wanted to talk about Spanish influenced English here in this section.
Yeah. Just one day, because my mom shut the door, and then I stayed back, and then it started to bleed in the store, and it was really fast, and then it was bleeding a lot. I was crying.
We wanted to, so the purpose of highlighting this was to say, so if a child came to you and maybe didn't know about their language background or dialects that they hear, you may think, the grammar is not excellent. You may think that it's, a cause for disorder. But we wanted to highlight it's really important to know about the language background used in all the dialects that A hears to see that in our minds this is typical and it's an acceptable response.
And it takes 2 years to develop social language in a different language, and it takes 5 years to develop academic language, which is, and as I'm saying, they're getting just 30 minutes of instruction. I think, in my opinion, I think they even need more time than just 2 years to develop equally proficiency with their monolingual kids. And this, we did it for following directions, but also we had a book. We told her like, oh, can you get a book, turn the third page and write your name. So tasks don't have to be just in a picture and pointing. They can be around the room too. And we looked then 2 to 3 following direction commands. Like point to the boy with the headphones, ask Gary, point to the girl who's drinking the juice, and she was able to follow like a variety of directions. And for this, yeah, we did them in English. And why I like this one, because it's very simple. It uses a lot of vocabulary that the kids usually exposed to. And I think that's for following direction. I think we need to be careful if the kids know the vocab, and because not really what are we testing. We're testing if they can follow directions and not really knowing the vocabulary. And then we did like some problem-solving questions, like very simple. What would you do if you were in school and start raining? Just to see if they can answer some like simple, logical questions without any like visual support. So I was able to do that. And that's for, then we did the spoken paragraph where we read this to her. She didn't have any visuals with it, and then asked her questions. And that talks about a snowy day in school. So it's a scenario that she's probably familiar with. And there's more for age ranges. There's more different paragraph length and different like complexity. And then we asked her questions about it. What did the teacher tell the student? Why did the student start clapping and laughing? And that looks at inferencing. Why to know if she would be able to draw from her prior knowledge. And she did. She did a good job answering all these questions.
All right, so we're going to talk about some tasks that we did for expressive language. So our portion of expressive language was analyzed primarily through a language sample. So we did this through a narrative assessment using the picture cards with the bunny and the girl that go to school. After we asked her to sequence them, she gave us a narrative about what happened in the pictures. And then we used a chart reviewing development of syntactical structures in bilingual and monolingual environment. And if you're a Spanish speaker, you know Yo Sabo is not the correct form, but it's kind of goes to, it's like a, it's ironic, I guess, the word I'm saying, looking for, but it analyzes when they acquire these structures.
Morphological structures, and it's usually it's what is exactly, it's like a bunch of research that is consolidated into this sheet, and it gives a lot of age ranges, and some of them they would say like from 3 to 9, but we know things are more. There's age ranges for everything. That's,
and now I remember what I was trying to say. But a lot of times in preschool kids, when they're acquiring that verb, they may say yo sabo because they know there's verbs that change to that ending when they haven't yet acquired. It's abnormal you say yo say. So that is what it means.
Yeah. What does it mean?
It means I know.
I know.
And we weren't able to put this in our resources because of where we got it from. So if you guys want us to send it out to you, you can just write your name and email it. Okay, so this is the second group of cards that we used to test her. I believe this one was in English and the first one was in Spanish. But again, in a true evaluation, you really just accept what the child gives you. But we wanted to look at both languages. So the same thing with this one. We asked her to sequence the cards and then tell us the story of what happened to the little girl with the dog. Okay, so this is referring to the first set of picture cards. Sorry if that's a little confusing. But so she gave us a narrative in Spanish, and I believe here she first started talking in English to us, even though we asked her in Spanish. But in her narrative, she can tell us the main point of the story. She uses relations to introduce the characters, so we see elements of, she talks about the girl, the children, the bunny. She uses single word sequencers such as primero y después to provide temporal cohesion, so she lets us know first this happens, then next this happens, and that helps us understand the story. So those are things we're looking for when we assess. And she was also able to answer questions about specific events and provide logical explanations. So we asked her things like, why did the kids cry or laugh? Or why were they surprised? And she was able to understand our questions and give us logical responses. So this is the one that's referring to the pictures we just showed, but this was in English. Her narrative is listed here. Again, she tells us a concise narrative here about a girl who finds a dog and brings it home. And she again introduces the characters of the story. She uses pronouns. She talks about the girl's mother. And she continues to use those temporal things that we're looking for. In comparison to her first narrative in Spanish, here she includes dialogue from the girl's mother. And she also talks about theory of mind and talks about mental states of the characters. Aisha and I have discussed this about the difference between these two narratives, and we feel like this one was a slightly more elaborate versus the Spanish, but that could be due to maybe narrative storytelling elements of the languages. It also could be due to language preference, we're not really sure, but so yeah, we just wanted to put that.
Was this all done in one day or several sessions?
One day.
Okay.
And
She
took
was
us
a trooper.
yeah, it took us like an hour and a half.
Yeah.
Yeah, but we didn't have any behaviors like some kids are
She was
harder. She's very compliant.
And then which one did you do first?
We did the bunny in Spanish first. So this is some piece that we got from the handout, and these are just examples of some of the syntax and morphological markers that she acquired or that she used during the evaluation. And we just listed examples here. So we just wanted to show when we were doing our analysis, we looked to see had she acquired first person singular, second person, preterite, all those things that are elements of our speaking. And this is similar to what you're looking at when you use a standardized test as well, but it's just to show that, you know, you can do this also without using.
So then we did a dynamic assessment, and we decided the dynamic assessment task, since we noticed some difficulty with comparing and contrasting, and that's more a common task for kids that age to know. And the material that I use there is it's more like a guide handout that tells you, oh, how much the effort you put, how much the effort the child put, and kind of help you process what happened. It's to measure the learning, how fast they learned the thing that you taught them. And the mediating experience is I showed her, I modeled comparing, contrasting 3 times, and like gave her feedback on how to compare and contrast, and then she was able to do it on her own with 2 trials, and even at the end of evaluation waited again and did it again, and she was still able to maintain that, and she did it spontaneously, and that's why we thought that she has learning, typical learning patterns, because usually kids who are have more difficulties, they take more time, or you would see in your sheet that you put a ton of effort and repetition, and they still didn't get anything of it. Yeah, as I said, like fast mapping is about mapping the word with a specific object and familiar object, and that even could be with names. If you show them a story and you said, oh, this is the name of the person, but just make up a name that's phonetically and linguistically is the same as the language that you're targeting. And there's a module on the leadership project, and there's another module in ASHA too about how to do how to do it. There's a good article in the resource too.
So our overall impressions of A, we found that she was typically developing. We didn't have any concerns, but we reconfirmed that. Her language dominance was, at this time we felt that she was equally balanced in both Spanish and English, but it started to see, well, we felt that she did have a preference to speak in English. She actually told us she didn't like to speak Spanish, but also her schooling has been in English. So in those types of, in regards to that, she had a little bit, she was used to speaking English about academic tasks. She demonstrated typical learning abilities, what Aisha was discussing with phonemic assessment. Her mother concurred with the results. She thought her behavior was representative of her typical day-to-day. We said that although she's in a subtractive bilingual environment, as all instruction is in English, so that kind of takes away from her Spanish development, we felt that she still maintains both exposure to Spanish as she speaks to her family members in Spanish and hears it pretty consistently. We felt that her conversational Spanish was age-appropriate and functional. It was evidence in her Spanish narrative and also through conversing with her. And we said that she demonstrated higher academic language skills in English, which makes sense. Okay, so we want to revisit the things that we asked y'all to keep in mind at the beginning. We really want to reiterate that standardized tests should never be used as a sole factor in determining if a child has a language disability or if they're eligible for services. But we understand that, you know, we're bound by some practices by agencies such as a school or maybe infants and toddlers who I work with. So if they do require a score, practitioners or clinicians should know there are some issues associated with scores, and you should really use the other information that you've gathered to make a decision about if that child has a language disorder. And also, again, implications of misidentifying children. More minority children, including English language learners, continue to be served in special education than would be expected. So we're seeing an over-referral, and we really have to think about what are some of the reasons why. And again, decisions made on behalf of 4-year-olds, they rarely shift. So if that child is misidentified young, they may stay in special education for a very long time. And that's so much classroom time missed, and it's really unfortunate. So we want to prevent that as best as we can.
20% are over referrals in just in New York State. I'm not sure over here, but that's a lot for ELLs. Working toward inclusivity, like even if you don't speak the language, I think it's important to feel the parents they should see that we encourage them to speak their own language. We even make them that we take in consideration the books we use, the material we used. I think that's huge importance, especially to make the child feel empowered and confident about their speaking their language. And with my kids, I talk a lot about bilingual. I call them, you are a bilingual child. That means you speak 2 languages. Oh, I do speak more language. Oh, let's look at this book. And some books have bilingual text on them, even if you don't read it, but they see it. They see it in the literature, in the books that are around them. Just make them aware of it. And usually a lot of the kids I see, the first day they come in, no, I'm not going to speak it. And with time, I was like, it's okay. You can speak whatever language you tell me, but I'm going to keep speaking this language. If you want to join me, you can join me. Can tell a parent repetitively how important they should keep it up. And there's a ton of material from various cultures and languages, international children's libraries, great resource. Educate parents about the benefits of bilingualism. And there's a great article in the Spectrum about how bilingualism is very, very beneficial for kids with autism especially.
For the sake of time, we have one slide. We just want to reiterate that bilingual child is not 2 monolingual children combined. We really should treat those 2 types of children differently and not hold them to the same standards. Their performance should be analyzed in both languages. We should use assessment tasks free of cultural linguistic bias. Again, we should not base refer to IDA?